and get started. Thank you so much for joining us and welcome to today's webinar, Is Black Boy Joy Enough? Expanding the Possibilities of Black Male Mental Health and Well-Being. My name is Jackie Zimmerman. I'm the manager of public education, partnerships, and e-learning, and I'll be here to help moderate today's session. But joined with us, we have Brandon Bond, who I'll introduce in just a second. I have a few notes for you all first. This webinar is being recorded and will be emailed out to all registrants within 1 week. We currently do not offer CEUs, but if you would like a certificate of attendance, we do have a form that you can complete to request one. I'll post the link to that form in the chat here shortly, and that will also be included in your follow-up email if you have any troubles accessing it in the chat. On to introductions. We'll get right into it. With us today, we have Brandon Bond, who is a mental health and well-being student advocate at the University of Michigan, holding a BA in biopsychology, cognition and neuroscience, and international studies, global environment and health, an MPH in health behavior and health education with an injury science concentration, and an MSW in global social work practice and management and leadership. Brandon brings extensive expertise to his role. As a wellness coach, Brandon specializes in delivering individual and group multicultural wellness coaching sessions. His commitment continued as a lead facilitation specialist for the launch of the Young Black Men social media-based intervention at University of Michigan. Brandon furthered his wellness work as an Active Minds Emerging Fellow, orchestrating an integrative wellness pop-up barbershop event for males of color on campus. Brandon's advocacy extends beyond campus borders. Collaborating with Active Minds and MTV Entertainment, he actively contributes to creating and implementing a national youth mental health peer support campaign called Ask, Acknowledge Support and Keep in Touch, the new Stop, Drop, and Roll for informal peer support. Additionally, he passionately advocates for federal peer support advancement policies through Mental Health America's inaugural Young Policy Accelerator. In the nonprofit sector, Brandon serves on the board of directors for Garrett Space, a young adult suicide prevention organization, and the International House Ann Arbor, promoting cultural humility and global understanding. He also serves as mayoral appointed human rights commissioner for the city of Ann Arbor, protecting human and civil rights of its residents. Welcome, Brandon. We are so lucky to have you. All of your accomplishments and accolades are so impressive, and we are just so grateful that you're able to join us for this next hour and really dive into this topic. So without further ado, I will hand it over to you.
I appreciate it. Thank you so much for that kind introduction. I hope everyone on this call is doing well. I'm super excited to get to explore the question of, is Black Boy Joy enough? And also looking into some of the opportunities for how we can grow our understanding of Black male mental health and well-being. So as we get started, and I'll be looking away sometimes at another screen for another slides and everything. But before we get started with the main content, I wanted to go over a couple quick definitions and considerations to make sure that we're grounded in how we frame this upcoming content. So we're going to be coming into this webinar from a range of different vantage points. So it's really important that we all have some type of similar baseline in terms of particular words or concepts, so that we can make sure that we can have the best understanding with each other. So the language that we use and our understanding of it, it really influences the narratives that we really assign value to and look into as well. So you'll see later in the presentation what I kind of mean by the importance of picking our language, and specifically, and also the impact of narratives. So when it comes to some of the terms that I'll be using throughout this presentation, one is Black. So there are various Black experiences based on skin tone, based on if you're biracial, multiracial, if you grew up in Black culture or not, and many other things as well. So I really want to make sure that we're still recognizing that much of the diversity of the Black experience, it still needs a lot more identification. It still needs a lot more consideration. And that'll be important when we're talking about the concept of Black mental health in general. And then American, this presentation is focused primarily on African American mental health for men. And I think it's really important that we recognize that there are people of African descent that aren't born or raised in the US. So they might have some influences to their mental health and well-being that may or may not resonate with the African American experience. So being able to hold that truth as well. In terms of male, I kind of use that as opposed to man or men to kind of think about gender spectrum, and their varying levels of the male identity and like what that might entail, and also thinking about gender too, or age as well. That's an important contribution too. My perspective is coming from a cisgender perspective, so just take all of that into consideration as we move forward. But I do want to make it abundantly clear that this topic is, it can't be adequately addressed or uplifted without consideration specifically for the trans masculine, our femme males, different sexualities and attractionalities, all the people in these communities. So really want to make sure that that's a key part for this conversation, but also conversations moving forward. Our narrative is not complete without them. In terms of well-being, I'm basically looking at this in terms of a lifelong journey of finding, promoting, and sustaining holistic health promotion. And for mental health, I am using the definition, it's a dynamic state of health that enables people to cope with stresses of life, realize their abilities, and to learn well and work well and contribute to their community. So hopefully that helps with providing some insight into how I'll be talking about this as we go through the presentation overall. So moving along to our content notice, some things in this conversation will be a bit more hard-hitting in relation to speaking about Black male mental health and well-being. So there will be some concepts or topics or conversation around inhumane mental health diagnosis and treatment, experimentation on Black bodies, forced institutionalization, and also practices that restrict bodily autonomy and consent. I do not intend at all to use graphic descriptors. Those will be as minimized as possible going through this overall presentation. So, what are we doing today? So this is our roadmap. So there are four main sections for this presentation. We're going to start off with exploring where we've been. So we'll kick things off with doing a quick examination of the historical influence that has contributed and still contributes to modern day Black male mental health and well-being. We'll fast forward a little bit into looking into where we're currently at. So we'll do a quick overview of what we're currently experiencing and some additional nuanced factors that specifically pertain to the Black male mental health and well-being experience. Next, we'll get into our visioning stage and dreaming stage and start looking into uh, transitioning into exploring the realities that we want to see in relation to Black mental health and well-being for our future. And then we'll kind of wrap up the final section with exploring various aspects and methods for how we can go about achieving these hopes and dreams and goals for Black mental health and well-being for our male population. And then I'm going to try my best to wrap things up and leave at least 10 to 15 minutes for questions. As questions and comments come in, feel free to use the chat. I'll try my best to like look into it and everything. But Jackie will also be noting down that for our Q&A session. So with all of that being said, I think we can get started with everything. So the first thing we have again is where we've been. Again, I want to really specify the importance of recognizing our history as we go into topics like this. And I also have some quotes on each of these sections that will highlight some wisdom from Black women that are also helping leading this charge as well. So going into the historical context, it's really important, and you may be asking yourselves, how deep does the history of Black male mental health and well-being go? Well, it's deeper than we all may know. There's a lot of different considerations that are important and influential into the stories that we tell for Black male mental health and well-being. So one of the first things to start us off is looking into the diagnosis aspect of it. So the field of mental health was noted as beginning with Williams Sweetser, I think that's how you pronounce his last name, and his use of the term mental hygiene in 1843. So once we fast forward a little bit to 1851, we will meet American physician Dr. Samuel Adolphus Cartwright. So in this time, around the 1851 time, Cartwright is known for his expertise, specifically in the diseases and peculiarities of the Negro race. In his findings, Cartwright invented two significant diagnoses that, in all honesty, essentially doomed the Black community from the start in terms of mental health and well-being. So the first diagnosis is called drapetomania. Some of you may have heard of this, some of you may have not. It was a newer concept for me that I learned about in the last couple of years, but drapetomania is characterized or was characterized as a psychological disorder that caused enslaved Blacks to run away from their bondage from the Civil War. And to help prevent this deviation and desire for freedom, and kind of like a rebellious act in a way, the treatment for that from Cartwright's perspective was that prevention strategies included whipping slaves and also engaging in additional dehumanizing tactics to ensure that the enslaved remembered and felt that they were no more than a quote, submissive knee benders. So, and this was also really important because it ties in aspects of religion and spirituality. Cartwright believed that part of the reason that this was the right tactic to use, the right diagnosis, is because white men were basically ordained by God to declare, yeah, Negro men as submissive knee benders. So when we think about that aspect really quick and someone's desire for freedom, and how that contributes to, or how that is seen as a mental disorder, someone's literal life and desire to um, hold their dignity up as much as possible and to just see seen as human, that's seen as a disorder, or a condition that is in need of treatment. So we can see how that can somewhat translate to current days as well. The next condition or diagnosis to mention is, and I want to try my best to say it, di dia uh, diastra ethiopica. I believe that's how you pronounce it. Don't quote me on that, but that is also a disorder that Cartwright basically coined, and essentially it's a mental disorder that is characterized by exceptional laziness and inability or insensibility to pain when being whipped, a sense of stupidity, and also a kind of tendency to destroy equipment as well. So we can see how some of these conversations and topics or thought processes, like we can still hear where that shows up in the modern day as well. So unfortunately, this language and this sentiment isn't that unfamiliar in the present day, and it really does stem back partially from this time period as well. Some other things that are going into our historical context that I won't delve too much into because there are several experts and books out there on it, and we still have a lot to go through in the time that we have. But one key aspect of our history for mental health and well-being for the Black male population too goes into experimentation. So again, I won't go as far into depth with this, but Harriet A. Washington has 528 pages worth of examples of anti-Black medical experimentation that Black Americans have endured since colonial times in her book, Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present. I encourage you all to read it. There's a lot of key critical aspects that are incorporated into that story. A lot of those stories have been eliminated from our history intentionally, so it's really important that we know as much as possible to, again, get the best perspective we can on how we can support our Black population in general, but also our Black mental health, our Black male population as well. Additionally, another key aspect of our history goes into the history of asylums. So asylums were essentially places where The Black population, especially Black men, were essentially discarded, are forcibly committed to asylums. So this meant, and this also eventually evolved into different aspects of the prison system, jail, juvenile detention centers as well. You can again look more into this in depth with Antonia Hilton's book, Madness, Race and Insanity, and a Jim Crow Asylum. She mentions a ton of great opportunities and insights from people that were directly impacted and lived or treated patients in that um, asylum setting, and mentioned a lot of different aspects in terms of people's placements and the rationales behind that, whether that was due to them being an orphan or seeking better treatment at work, and kind of like advocating for themselves. One person in particular, he was forcibly committed to the asylum just because people found his accent to be suspicious. So you can see just how deep, again, this goes overall. And then going into preservation, that's also really a key aspect of this work and conversation too, because it's really important, again, that we recognize our history, but we also have to recognize that unfortunately, due to many deaths, intentional separations, document erasure, inaccurate recordings of reports and everything as well, that there are significant gaps and inabilities to understand the complete range and full picture of the Black male mental health and well-being experience. Again, that was very intentional in many cases too. Now, transitioning a little to specifically the male population, it's really important that we're also talking about toxic masculinity and the role that that has in this work too. So when talking about our thoughts, beliefs, and behaviors for male identifying people, it's really important that we consider the femininity and masculinity aspects when it comes into play with mental health and well-being. So the term toxic masculinity originated in the 1980s. And I suspect that even though that term originated then, that it was very much present before that term existed. But toxic masculinity of overall essentially is looking into the overamplification of various values, attitudes, and behaviors that are associated with men in a stereotypical way. So in terms of strength, lack of emotion, self-sufficiency, a sense of dominance and sexual drive, and many other things of that nature too. But when we look at the core aspects and peel away the layers of toxic masculinity, I also want to highlight that at the root, a key part of that is a desire for control. Now, when we're thinking about that, it's very similar to emotions as well. And it's a pretty innate desire, in my opinion, at least, that everyone, or at least most people, they want to have control over their life. They want to um, have that sense of agency, that sense of power, and opportunity for themselves to express themselves, to navigate their lives as much as they want. So taking control in a way, for me at least, it's not seen as a positive or negative thing. I think that's kind of just like a neutral aspect. The thing that I think can be assigned positive or negative are the actions that take place to gain or sustain that control. That can have a lot of lasting harm or damage on people. So when we're thinking about this in particular for the Black male population and their history, which we just kind of went over in terms of thinking about the control and humanity that's been diminished at every single opportunity that they can take, and the fact that I didn't even go in depth or explain the full range. These are just some key areas, and we're thinking about all those opportunities to degrade our sense of humanity and purpose and value. You can see how people, especially Black men, may be a bit more defensive or protective when they have some aspect of control or some amount of control. You really want to hold on to that as much as possible, and it kind of feels like a survival tactic in a way. And I do want to mention that this is not just toxic masculinity is not just assigned to the Black male population. Anyone can exhibit it. Everyone can have femininity. Yeah, can exhibit aspects of femininity or masculinity. And it's also toxic masculinity is not a justification for any harmful behavior. as well. Like, yes, we do still want to have control, but it's still not an excuse or a justification for causing harm for other people as well. So, the last thing I'll mention is that while all the things I mentioned are pretty horrible, pretty horrific and everything, that we still do have historical aspects that have contributed to the positive nature of our mental health and well-being too. So while there's a lot of or tragedy and inhumane events that have contributed to the state of Black male mental health and well-being, there's also various aspects that have contributed to our opportunities for coping and healing as well. So with this, we can think about with the lack of care, trust, and access to quality mental health treatment, part of the Black community's healing process has included non-clinical practices, gaining and protecting our aspects of control, making sure that we are engaging in humanity and dignity restoration interventions as well, and also looking into making sure that we can be within community, whether that is in church or a cultural specific location like a barbershop or salon. We embed it in our food, our music, our hair, our clothing, and many other attributes as well. So, our experience with mental health and well-being so far has, for the most part, been a very dehumanizing series of events, which really makes it, um, I guess, like very easy to see why in our current day that there isn't as much trust in the medical field. There's a fear of also being seen as unhealthy, and there's also a resistance to sometimes sharing personal information and cultural information too. So going into kind of the next steps of where we're at, it's we're gonna be looking into various aspects of where we're at in the current day and different attributes that are associated with that, different nuance factors that are coming up with this too. So, one of the key aspects are statistics that is very alarming, is that there's been a 60% increase in suicide rates among our Black male population over the past decade. So that is a drastic increase overall. So you can see just how much things have gotten better to some degree, but there's still several instances where things are not where they're at to support the Black male population with our mental health and well-being in terms of the support we need, recognition, and a lot of other aspects with that too. Some additional statistics are that 1 in 3 Black men who need mental health care actually don't receive, or they do receive that. So that's not that much considering the population that we have. And then also thinking about our access to care, 5.3% of there's a 5.3% Black men unemployment rate, and that's the highest when compared to Black women, Hispanic men and women, and white men and women as well. And when thinking about that as well, it's really important to think about someone's employment status because that can also be um, a key factor in terms of thinking about their income stability or insurance and using that for their own care as well. And then also when we're thinking about it from another lens or another vantage point, we can also think about how that is contributing to or how someone's employment contributes to their personal sense of worth. Dignity and value to society. Many people want to contribute to the world, and work is just one way that a lot of people may find that happening. Now, going into some additional experiences for the Black male population that are probably like a bit more unique. There's still quite a bit of overlap between other populations as well, but in terms of these scenarios or topics, these are pretty specific towards the Black population, in particular in terms of statistics and accounts. So when we're thinking about the value of the Black male body, that is one key aspect of the Black male experience. So our bodies and our minds are usually just seen as only being good for entertainment, whether that is in sports, sex, or art performance. Outside of when you think of the top celebrities or well-known people that are Black men, most people are most likely going to be athletes, musicians, or some type of entertainer overall. We don't really get as much um, attention or respect when it comes to our minds. We're not seen as intelligent and again, kind of going back to that historical aspect, we're seen as less than like we aren't educated, like we don't have the capacity to be educated as well. So when we're thinking about the value of our bodies, we also see it in the hypersexualization and criminalization of our bodies too. So Black men are more likely to be depicted as hypermasculine or sexually promiscuous in television and film in comparison to men of other racial or ethnic backgrounds. Additionally, for the Black male population, it really impacts our mental health with this objectification and criminalization because it just gives us a sense that we, again, are not fully human. It contributes to low self-esteem and psychological distress. In terms of the criminalization aspect of it, there's, again, a lot of objectification and stereotyping based on our race and our sexuality. And in many cases, we can even be criminalized for our sexuality and various attributes associated to that as well. Then again, going back to what I mentioned at the beginning, with the queer population, it's really important that we also recognize that aspect of the Black male experience too, whether that's in terms of our gender, our sexual attractionality, or anything else. When we are forced to restrict our expression of non-hetero attraction or gender fluidity or just sexual desires in general, that has a negative impact on our overall mental health and well-being of, again, not always feeling that self-esteem or feeling desired or feeling that we are being taken advantage of in certain situations as well. Um, Again, Black men, specifically Black queer men, are disproportionately targeted by laws and policies that criminalize our sexuality too. In terms of personal safety, I'm sure this is not a surprise to many people, but we have been under attack probably forever, in all honesty. And according to the CDC, homicide is one of the leading causes of death for our Black male populations between the ages of 15 and 34. And in 2019, the homicide rate for Black males was more than 6 times higher than the rate of white males in the same age group. So you can see how that is a very unfortunate and harmful thing to kind of be, or not kind of, but you are just bombarded with that consistent grief. Like these homicides are people's sons, brothers, fathers, partners, uncles, and everything else in between. There's a lot of lasting impacts that has on the individual, but also those connected to them as well. And it's important to think about not only what's happening to the individual, but those connected to them. Additionally, incarceration is something that is unfortunately very present in the Black male population too, with Black males being incarcerated at a rate of 5 times more than white males. So that's also really important, again, when we are thinking about the evolution of asylums to prisons. Prisons are essentially our mental health providers. They house the majority of the people that desperately need, but may not always have access to mental health support. And when we're thinking about mental health providers, it's also been like a common conversation as well that a lot of people, they want to seek out someone that truly understands them, that they can identify with as well. But the fact is that only 2% of psychologists in the United States identify as Black or African American. And this 2% includes both women and men. So that you can see that it's not very sufficient overall when we are seeking out support or recognition for people that like truly get us and kind of we don't have to explain certain aspects. From my time doing peer support work or coaching work and working with students, especially those of similar identities, we just have like a hidden language. We can have whole conversations with just a glance, a look. But you don't always get that when you are working with people that aren't of that same background as well. So that can sometimes provide or prevent opportunities for trust and other aspects to help produce the most health promoting setting in general too. Now, again, all of these are not great statistics. They are very horrific and terrifying, and they definitely need a lot more work. And one thing in particular that is more so on the positive side of the Black male experience is the Black Boy Joy movement. So this was coined by Danielle Young, and Black Boy Joy is essentially a term that celebrates the um, happiness and promotion of young Black men and really making sure that their representation of their humanity is presented too. And this is a form of a counter narrative to the negative stereotypes that I just previously mentioned and the negative portrayals that we see in media and society in terms of Black males being deemed dangerous, aggressive, and lacking a sense of overall opportunities for joy and lacking humanity as well. So, with this alternative narrative, that's going to help transition us into our next session when we are thinking about where exactly is it that we want to go in terms of Black mental health and well-being for our male population. What are our goals? What are our dreams for what this can look like and what this should look like as well? So, a key aspect of looking into what those goals can mean and how we can get to it in a way is looking into the concepts of dominant and alternative narratives. So, dominant narratives are essentially um, a lens in which we view the world, and we are thinking about that from the lens of quote unquote like dominant culture. So whether that is white culture, cisgender culture, English speaking, a lot of other factors as well. But essentially, dominant narratives, those kind of run the world. They determine what we invest our time in, what we believe to be true, how we treat each other, our culture, how we're socialized as well. So when we're thinking about those different narratives that are currently in play right now and the importance of needing to promote a different world, a different culture, if we want to embrace that change or have opportunities for that change, we can't continue to subscribe to these dominant narratives. We need to find alternative opportunities for that. So alternative narratives are essentially the counter argument or counter opportunities or additional narratives that can be pushed out that are much more seen in a positive, progressive, and humane way, as well, that also incorporate various aspects of intercultural representation and human rights as well. Because again, we want to make sure that the narratives that we are pushing forward, the truths that we want to um, feel and hold on to, the cultures that we want to exist in, we want to make sure that those are as inclusive and health promoting as possible. So that's one of the aspects of, yeah, presenting an alternative narrative. So I have a quick exercise for us here and looking into what does it actually mean to uproot the suppression tree and promote alternative narratives overall. So you can see from this image on the right-hand side, the oppression tree, that there are basically three main sections. So essentially the bottom section is the roots. So that's where all these conversations are coming from, all the thought processes and everything else. So those will be considered the dominant narratives. And when we're thinking about a tree, that is the root. Everything grows from that. Everything is informed by what's growing from those roots as well. So as we move up to the next section where the trunk is, you can see that that's kind of where the institutional or systems-based aspects are there as well. So in terms of our education, our employment, our laws, policies, court systems, health systems as well, those are going to be influenced by what we deem to be true, what we associate with having value or what we're willing to invest in as well. And based off of those systems and institutions, those produce some of the more so like everyday things that we're seeing in our current day, whether that is different aspects of racism or microaggressions, macroaggressions, um, other aspects of having lack of access to opportunities, having lack of access to education, and other things of that nature as well. So when we're thinking about uprooting this tree, one exercise we can do really quick is thinking about this dominant narrative that many of us have likely heard of thinking about in terms of Black men, that Black men don't seek out professional mental health support because they are concerned about stigma. And in all honesty, there sometimes with dominant narratives, there can be um, validity to it, there can be truth to it, and it can actually sound logical as well. I think we all know for the most part that that is a key aspect, stigma, as to like why Black men don't always seek out, yeah, mental health support in general. So some dominant narratives, they aren't necessarily horrible or harmful and everything, but it doesn't mean that that's also the narrative that we want to continue to push forward. So, in terms of thinking about that dominant narrative, something else we could think about is the dominant narrative of, or an alternative narrative of Black men don't seek out professional mental health because they have fill in the blank, because they are fearful of what does it mean? Are they don't have an adequate representation of what healing looks like from a mental health professional because XYZ opportunities. So it's really helpful to, when we're thinking about these alternative narratives, to kind of push some of those aspects forward. And one thing that I want to push forward for this is that similar to the dominant narrative and kind of alternative narrative of Black Boy Joy, which don't get me wrong, is amazing. I'm a Black boy. I really want my joy and everything, but something that I think can be an alternative narrative to that or an additional narrative to that is what if instead of Black Boy Joy, we were also promoting the full spectrum of our emotional states that Black males can exhibit through their lens. So let's not just promote Black boy joy, let's promote Black boy anxiety, gratitude, grief, resentment, jealousy, awe. When we can look into all these different aspects of humanity, of our emotional state, then we can have a better understanding of not only ourselves, as Black males, but we can also um, have a better sense of humanity from outsider perspectives as well. When you see the full range of what someone is, what someone can be, then you can't deny the humanity they have. You can't continue to promote or restrict people from having access to mental health support or not funding education in this realm and other aspects of that. So let's think about those type of opportunities. If that was at the root of the suppression tree and we saw the full spectrum, what would that have looked like back in the like 1851 with Cartwright, if that was the narrative that was pushed forward in the first place. We wouldn't have had those experimentations because we would have seen people as fully human. We wouldn't have had people going to asylums and being forced there because, again, we recognize their humanity. We recognize that certain situations, they do deem certain emotions as well. Again, emotions are not the they're not negative or positive. They're something that are a guiding post for us to essentially serve as key indicators for like what we're expressing. Like if someone cuts me off on the road, I don't think I should feel gratitude necessarily. I should feel like a bit of anger. That's an appropriate response for that situation. Now, if I get out of my car and do stuff or have road rage, that behavior, that isn't something that should be condoned. But again, emotions are essentially just a guiding post and an opportunity for us to recognize the humanity within ourselves and within each other. So if we can continue to think about the alternative narratives that need to be pushed out, then we can have a better opportunity of making sure that we can provide different supports. Because again, if we work at the roots, The institutions, they will be informed, they will have to change and adapt to those new alternative dominant narratives. And then the behaviors that we're seeing in everyday practices, so those branches and leaves, those will also be something that are that will be forced to change as well. And it's also important to think about not only the trees in an individual sense, but also looking at it from the sense of that tree might be in a forest. So there are various other aspects. Again, the Black experience, the Black male experience has so much diversity within it. So when we are looking into that forest, we can't just tend to one tree. We have to be considerate of the forest that we're also I guess, inhabiting as well. And also recognizing that a lot of those trees, they're only as good as the soil. So we have to make sure that we're also tending to that as well. And that this isn't just a one-time thing. This isn't just one alternative narrative. There's going to be continuous work that needs to be done to make sure that we can push this again forward as much as possible. So yeah, lots of words, lots of thoughts. It can be really difficult to sometimes even determine what dominant narratives are. Kind of just continue to ask yourself, why things are the way that they are, or if someone is saying like, hey, yeah, everyone clearly knows that this is true and this is how things work, then that is something to consider that that might be a dominant narrative. So keep thinking about those aspects. What are some of the dominant narratives that you are coming across in your everyday life or things that you're subscribing to, and think about if those are helpful for your overall yeah, mental health and well-being, or for the mental health and well-being of others, specifically, again, our Black male population. Now, getting a bit into some quick interventions and thinking about how we can kind of get to this state of the wide range of Black boy mental health and well-being from various lenses of joy, sadness, and everything else. It's really helpful, and I like to try to incorporate different action steps and very tangible things to either look into or to start practicing as soon as you hop off this call. So this section will be looking into some of those aspects. So a couple interventions that I've personally been a part of. One is the YB Men Project, which stands for Young Black Men. So this was created by Dr. Daphne Watkins. She's currently a professor in the School of Social Work at the University of Michigan. Amazing soul. So she created this program, which is essentially a social media-based intervention for young Black men to connect and have conversations. It uses current topics to kind of get people just invested in the conversation as opposed to more of the, I guess, like stale clinical whitewashed aspect of how certain clinical sessions can go or therapeutic sessions can go. So that was one project that I was fortunate enough to work on as a graduate student. And we saw really great conversations between our young Black men that participated in the program, and it's been replicated in various other institutions as well. So that is definitely intervention to look into for your institutions. I definitely recommend highlighting and connecting with Dr. Watkins if possible too. One project that I worked on, again, as a graduate student, as an Active Minds fellow, was building out a integrative wellness barbershop for men of color on my campus at the University of Michigan. So this was a partnership with a couple other units on campus, but essentially the sentiment around this is thinking about starting where we're at and bringing the mental health support to us, making it culturally tailored. So essentially this intervention, it was just having a pop-up barbershop on campus. Michigan is a very campus. We don't really have as much representation when it comes to our barbers. So for me, it was really important being an undergrad there, being a graduate student, that it didn't feel necessarily like the campus could really be my full home when I had to leave every time I needed something as simple as a haircut. It didn't really make sense to me how that could uh, necessarily translate that I have to spend additional money, additional time, and all of this to get, again, something as simple as a haircut. So with this project, we essentially worked with different local barbers, all men of color, and invested into their businesses. So we had paid them to come to campus, set up their chairs and tools and everything to cut hair for free for our student population. And while we were having people getting their hair cut, I facilitated a conversation around toxic definitions of success and um, also thinking about childhood trauma as well, which was a very interesting topic and very difficult topic to navigate when you're working with specifically men of color, but men of color that don't actually know each other in the first place. But we were able to bring in, again, modern topics, such as like the YB Men Project does, to help facilitate conversations. And that was a great success and opportunity. And it's this program that's actually continued on under the leadership of Gregory Thomas in our Office of ugh, Office of Academic and Multicultural Affairs Initiatives, I believe is the acronym, are the department. So that was a really great opportunity, again, to think about peer support, mental health support, specifically tailored for the Black population or BIPOC population, male population as well. In a non-clinical sense, in a way that you're bringing that to them. It's supporting their access to it and their engagement because people want quality haircuts from licensed barbers. Like they have the um, expertise in it. So why like barbers can be like $60 at this point. So again, going into the various aspects of wellness, financially, it's helpful. Environmentally, we can cut down on transportation. It's also providing that kind of environment on campus to promote that sense of home and belonging. It's promoting social engagement. Financially, they don't have to pay for it and a lot of other attributes too. And then with the conversations we're looking into in terms of purpose, meaning, healing, that goes into like the spirituality side of seeking out those opportunities. The next intervention that I've been a part of is the Ask campaign, which is through Active Minds and MTV. So this is a newer national campaign, which is essentially made to be the stop, drop, and roll of emotional peer support that anyone should hopefully have access to and be able to implement and integrate in their everyday lives. So you don't need any special trainings, any degrees or anything. ASK stands for acknowledge, support, and keep in touch. So it's just three very key fundamental steps. A lot of people mention that they want to support people that they engage with or people that may be going through something, but they may not always know the best way to go about it. So this can be a very nice initial and simple first step just to build up your confidence and courage in doing that. So when we're working with Black men, our Black males, this can be really helpful when thinking about how do I strike up a conversation, acknowledge what you're seeing, acknowledge what's happening, provide support whenever possible, and then make sure that it's not just like a one-off conversation if possible too. Make sure that this is a continuous conversation that you're engaging with them. You want to, again, build that rapport as much as possible. And then this last one is more so thinking about taking mental health and well-being from a prevention standpoint. So this is something that I try to do with my nephew. So he's still very young, but I try to ask him some critical questions of, all right, so you're feeling frustrated right now, whether it's with school or you didn't get this toy or whatever else. So being able to prompt some of those critical thinking aspects of acknowledging what are you feeling? Why are you feeling this? Not trying to say that you shouldn't feel this or anything, but just kind of building up that skill set of acknowledging and recognizing what those emotions are from a young age to better identify it for themselves, but also to better be able to communicate that to other people as well. That's a key aspect, again, going back to aspects of control as well, and thinking about when we can best communicate and convey our thoughts and what we're experiencing, that's a powerful tool, a powerful skill set to have that not a lot of people actually feel comfortable utilizing overall. So if we can build up our younger generation and be proactive with that, that can be really helpful. But this is also helpful for any age range as well. And then I'm going to quickly go through these additional actions because I really want to make sure I get to your questions since we're running up on time. But these are in no particular order. But one thing that I need everyone to take away from this session is that we absolutely need to protect our life extensions. So what I mean by this is that Black males, we are impacted by the people that we're connected to. We're impacted by our siblings, our family, our friends, strangers as well. So when we are noticing or witnessing harm done to those other populations or those that we're connected with, that harms us. That harms our mental health and well-being as well. So we need to do everything possible to make sure that we are protecting the life and rights of the ones that Black males care and love for. And just an FYI, that can be anyone. So we need to love and care for anyone that we come into contact with as much as possible as well. In terms of personal actions, I truly live by the quote that if you can't be a good example, you'll just have to be a horrible warning by Catherine Aird. That is something that has stuck with me. So when it comes to personal actions, I think of it in terms of the three E's of exposure, exploration, and education. And then also personal healing. I think that's probably one of the core ones that you have to start with first. Again, put your own air mask on, do the work yourself before you support other people. Make sure that you can actually speak to it and kind of lead by example. And then in terms of exposure, just try to share out as many opportunities and connections as possible with our Black male population. The more exposure we get, the more exposure points we have, the more we can see how life can be lived, the more doors we can open, the more we can dream and have those opportunities. But again, when we have limited exposure, we can only consider our dreams so much overall, especially when it comes to our health. Again, ask questions to Black males to um, kind of just like prompt critical thinking. So ask the questions that we don't know that we need to start asking ourselves or that we may not be asked normally. Make that a process for us to explore various attributes of, again, what our life can look like. Education is a key part of this too. So and thinking about our education, we need to also promote as many opportunities for mental health and well-being literacy. When we, again, can figure out how to recognize things within ourselves, convey it to ourselves, we're doing a better service to us and those that care about us. And then also when it comes to advocacy work too, one strategy in particular for I guess like mental health and well-being literacy, but also just education or reliance is looking into support pod mapping. So that can be really helpful in thinking about what are the supports that are in your immediate life? What are some of the supports that aren't there, but you want to make some effort into bringing that into your inner circle? And what are some of the systemic institutions or organizations that can also provide that support? Next is it's never too late as well, or too early. Again, you can um, promote and prevent harm and also build up sustainable habits, whether you are very young or working with very young people, or if you are very um, experienced and older or an older adult as well. It's never too early or too late to start engaging in this work and these conversations. And the last part I'll mention is that it's really important to think about this from a public health perspective. So every sector, every person has the potential to influence Black male mental health and well-being. Um, so as we are moving forward, it's important to think about that we are all connected in some way. Everything that we do is going to influence how we act, whether that is if we're working in housing and health and policy and education, it's all going to some way impact our Black male population. And just in a social aspect of it as well, we all have a shared legacy and a responsibility to work on this together. With all that said, I know that was quite a bit of information to throw at all of you on a Tuesday afternoon, but that is essentially everything I have. Thank you all so much for your time, support. I see like all the claps and everything. The chat was going off, so really appreciate that. And if you want to stay connected, please feel free to scan this QR code. It'll take you to my LinkedIn. And I'm happy to continue support connections conversations through that. And if you're interested in having me come as a public speaker for panels or anything else, I'm also a national public speaker with Active Minds. So you can, yeah, reach out to me at my email, brandon@activeminds.org. And yeah, looking forward to answering as many questions as I can in these last couple of minutes.
Thank you so much, Brandon. You're getting so much support that is so well deserved in the chat. I'm going to have you leave that last slide up because we have had a lot of people with questions about specifics of your program or learning more. So I would encourage you all, if you have specific questions about Brandon's work or you want to engage, want to have him come and speak at an event that you have upcoming, please take note of his email that he has on the screen right now. Maybe connect via LinkedIn. I'll be sure to include all of that in the follow-up email. I know also everyone has been super impressed with your slides, as I was. It's they're really wonderful and educational. So we will include the slides and the recording. Everyone will have access to that afterwards. You'll be able to view it and reshare this. So just a reminder. I know we have just a couple minutes left, so I don't want to get us too deep into any big questions. But one thing that had come up a few times that I'd love for us to kind of close on is just this idea of that you had on that last slide. What I loved is that never too early or late. I think that a lot of the comments in there were asking about, how do we start this in youth? How do we
Yeah.
acknowledge this with young folks? And then also acknowledging that in those spaces like barbershops, that's a place where our elderly population comes to, and maybe they haven't felt okay to have these types of conversations before. And so it's really opening up a space for people of all ages. Do you have any? I know you talked a lot about of building sustainable habits, engaging young people in conversations. I think it's just so important what you talked about with teaching young Black boys how to acknowledge feelings and that it's okay to share them and talk about them. Do you have any other advice for those that are listening that we're asking about how can we address this with youth?
Yeah, I think it goes back to, again, in a way, like starting with yourself as well. For me, that was like a part of my process for like healing and getting to this point where I can like speak on it and everything,
Yeah,
is that I had to seek out my own support, whether that was going to like a mental health professional or a medication or other attributes like that. So I think it really starts with that. And once I was able to kind of be in a better space, I was able to talk about that more with other people and recognize different signs and symptoms. I also think part of it is just, well, I guess like my background as well is very like service oriented too. So, and being a wellness coach, I think that also prompted questions that I
yeah,
felt like it was I was doing a disservice in a way to the clients that I was working with if I would tell them or reflect back certain aspects that like wasn't living into myself. So I think that was also really helpful overall. But I do think looking into certain, I guess, like key questions or just making it like a normal habit of just asking like how you're doing,
yeah,
what's new, or like how did this land for you? Other attributes like that or activities like that I think can be really helpful. And then again, I think the three E's of education, exposure, and exploration, I think those are also three key aspects to think about more again of whether we're gonna watch this documentary or go to this place or read an article or talk about like how it shows up in media and everything. Just anything that can help to start the conversation, I think is a good start for like again any age because yeah, it's really important that we are considering that generational aspect too. I am a firm believer not only in generational wealth, but generational wellness. So I think that that's also a very key aspect that we can all learn from each other. I'm learning from my nephew who's 7. I'm learning from people that in their like 60s and 70s. So you can learn from anyone, but it's just kind of being open to that opportunity, and then helping other people see that they can be open to those opportunities too. I'm sure like there's more to
Absolutely.
go into, but yeah, I'll leave it at that.
Yeah, I love that. And I love that generational wellness. And it really all comes back to that modeling. And there were a lot of, just to wrap us up too, I know we're a little over time, but a kind of final thought. There was a lot of comments in the chat and just discussion around stigma too, and stigma in the community and with Black males, and feeling like they can express and talk about how they're feeling, how they're doing. Um, the modeling of conversations, that it is okay to feel all of the emotions and not just the joy, not just those things of when you're happy and when things are going well, or that you have to always have that emotion, but modeling how it's okay to share other emotions, and then how you then cope is really important to show of how we're working through and finding ways of well-being. So I just want to thank you again, Brandon. This was fantastic. I know I'll share the chat with you afterwards because I told you not to worry about it while things were going, but there are just so many beautiful comments. Thank you all for joining us, for sharing your own stories in the chat, for sharing your perspectives. I really loved seeing all of your comments coming through. We appreciate you for being here for the last hour together with us. And thank you, Brandon. Just a reminder to everyone, this is being recorded. I know many of you were asking. It is being recorded, and we'll share that out afterwards. You'll receive it within 1 week. You'll also have the opportunity to request your certificate of attendance. And please do share the recording with others to continue to spread this message. It's a very important one, and we appreciate you all for being here today. And a final deep gratitude for Brandon.
Thank you so much for hosting this, for allowing me to have this platform and speaking on this critical topic. And thank you, everyone, for coming out today. And yeah, I hope we can start looking into some alternative narratives together and continuing the communication and community that we built today.
Absolutely. Thank you so much. Everyone, have a wonderful rest of your afternoon, and keep an eye out for our follow-up materials, and feel free to connect with Brandon and stay in touch with all that he's doing. Thank you.
Thanks. Have a great day, everyone.